Welcome to the 2019 ASHP Foundation Literature Awards presentation. For almost 50 years, this program has sought to inspire innovative research by recognizing significant pharmacist contributions to biomedical literature. The Student Research Award goes to Rhiannon Garcia and her co-authors. Their article, Pharmacotherapy-Induced Hepatitis B Reactivation Among Patients with Prior Functional Cure, a systematic review, was published in Annals of Pharmacotherapy.
As pharmacists, I feel that we have an obligation to aid our interprofessional partners in their risk management efforts when it comes to pharmacotherapy-induced adverse events. We hope that our work serves to arm providers with the information needed to employ patient regimen-specific risk management strategies to minimize clinical disease as a result of HBV. I view this recognition as a testament to both the incredible team who contributed to the project, as well as the mentorship provided by Drs. Naylor and Goodley.
The Pharmacy Practice Research Award goes to Gary Mott and his co-authors. Their article, Impact of a Pharmacist-Physician Collaborative Care Model on Patient Outcomes and Health Services Utilization, was published in the American Journal of Health System Pharmacy.
We found that the inclusion of clinical pharmacists in the primary care practices was associated with significant improvements in patients' medication-related clinical health outcomes and a reduction in hospitalizations and costs. Hospitalizations declined significantly in the collaborative care group, yielding an estimated cost savings of $2,619 per patient. These outcomes suggest that this care model has the potential to enhance population health, reduce healthcare costs, and improve the performance of accountable care organizations on key quality metrics.
The Innovation in Pharmacy Practice Award goes to Khalid Anjali and his co-authors. Their article, Impact of Requiring Reauthorization of Restricted Antibiotics on Day 3 of Therapy, was published in the Journal of Antimicrobial Chemotherapy.
We found that our intervention was associated with a reduction in restricted broad-spectrum gram-negative antibiotics use from 5 to 3 days, and a reduction in oral vancomycin use from 6.5 to 3 days. In addition, the percentage of patients who received any restricted antimicrobials for more than 4 days reduced from approximately 60% to 30%. These were associated with a reduction in length of stay 8 to 6 days without a significant change in hospital mortality. Pharmacists can have more roles as antibiotic stewards, and this novel strategy could be adapted by other hospitals to reduce antimicrobial use, costs, microbial resistance, and length of stay.
The Drug Therapy Research Award goes to Diana Soberway and her co-authors. Their article, Association of Inhaled Corticosteroids and Long-Acting Muscarinic Antagonists with Asthma Control in Patients with Uncontrolled Persistent Asthma, a Systematic Review and Meta-Analysis, was published in JAMA.
This project was a comparative effectiveness review sponsored by the National Heart, Lung, and Blood Institute to serve as the evidence base for a targeted update to the Expert Panel Report 3, the National Guidelines for the Treatment and Diagnosis of Asthma. Therefore, beyond the extent of our publication, our work is currently being used to support national guideline updating, which will in turn inform clinicians on best pharmacologic practices in the management of asthma. This project was truly a team effort, and I am thankful for such strong collaborators.
The 2019 Literature Award for Sustained Contributions goes to Vincent Tam. Dr. Tam is a tenured professor at the University of Houston College of Pharmacy and an adjunct professor at the University of Houston Cullen College of Engineering. Dr. Tam's work has focused on antimicrobial pharmacokinetics, pharmacodynamics, and antimicrobial optimization. He is the author of over 160 peer-reviewed articles and has served as an ad hoc reviewer for more than 25 journals. Dr. Tam also serves on the editorial board of the Antimicrobial Agents in Chemotherapy Journal and is associate editor of the Journal of Global Antimicrobial Resistance. Since 2002, Dr. Tam has received more than $9 million in research support.
We have a healthcare crisis with antimicrobial resistance, and the conventional new drug approach alone would not get us out of trouble. We need quicker solutions to address immediate needs of our patients. I work on translational studies which focus on optimizing antimicrobial therapy, dosing regimen design, and combination therapy. The ideas put forth have sparked conversations among key opinion leaders in the field and regulators, which have resulted in changes in susceptibility breakpoints interpretation, as well as consensus guidelines of optimal drug use. I am truly honored to be a part of this prestigious group of researchers that have won this award in the past.